Hello, my name is Jasmine Lopez, and today I want to talk about why the treatment drug AMX0035 needs to be approved by the FDA. Okay, so just a little bit about this treatment drug. AMX0035, also known as Amylyx, is known to treat the symptoms of ALS. ALS is a disease known as amyotrophic lateral sclerosis. And according to an article written by Becker in 2022, the FDA has refused to approve the drug for patient use due to it not being 100% effective in helping with ALS, despite research showing and clinical trials showing that it has helped some. Maybe it hasn't helped all, but it has helped some. ALS can be known to be debilitating. It is always fatal, and this drug can be used to prolong or even make their quality of life just a little bit better, which is all that important. And according to the article AMX0035 in patients with amyotrophic lateral sclerosis that was written in 2021, this treatment drug is shown to slow the decline of the muscle function within individuals that are diagnosed with ALS, which is super important. Okay, and a little bit about why this affects me and why this is so important to me. About a year ago, in July of 2021, my dad was diagnosed with ALS. We believe he's had it for about 2 years, but ALS is a little harder to diagnose. There's not a real test that can tell you that you have ALS. It's kind of just a series of tests and watching the progression of it. And according to the FDA newsroom, ALS is a progressive nervous system disease that affects the nerves in the brain and the spinal cord. With symptoms, they include losing the ability to speak, swallow, walk, move, and eventually breathe. With no cure, the average life expectancy of an individual living with ALS is 2 to 5 years. My dad, we are thinking he's on year 2. We're not 100% sure, but he has definitely been diagnosed for a little over a year. The approval of this drug is super important because if it can prolong his life or make him live a little bit more comfortably and slow the progression of the muscle loss, that would be life-changing. It would a few more months even would change everything. This drug has the potential of treating and prolonging the life of him, and it has not yet been approved by the FDA. They don't want to approve it because it's not 100% effective, but what drug really is 100% effective? Chemo in cancer patients, for example, is not 100% effective. So I feel the FDA needs to rush this into getting it available for everybody that is diagnosed with ALS, just to give them a fighting chance. So not only does the approval of Amylyx concern me because of my dad's diagnosis, it also concerns me because it can affect anybody. This disease can really affect anybody. People living with ALS have a shorter lifespan. The FDA is kind of pushing back the approval and pushing it back when these people do not have time to wait around. If this gets approved, these individuals might have a fighting shot at living a longer or more normal life. Although it's not a cure, it can slow it down. And according to the Mayo Clinic of 2022, only about 5 to 10% of people that are diagnosed with ALS is hereditary. The rest of the causes are unknown. So if you think about that, 5 to 10% is not a lot. And although it's not a common disease, it can affect anybody. They have figured out some common risk factors, one being age. They usually say about 50 to 60 age range is when people get diagnosed with ALS. My dad is 40 years old. He's a little earlier in that, a little younger for this disease. Sex, oftentimes males. It's more common in males than females. Genetics, again, it can be hereditary, but most of the time it is not. It's unknown. Smoking can be related to it. Military service. My dad did serve 22 years in the Navy, so we think that might be the reason he got ALS. We're not 100% sure. Obviously, it's not proven. And with that being said, we just need to care. We need to care about this drug being approved. We need to care about the treatments for this disease. That way we can hopefully prevent it in the future or cure it eventually. So that's just really why it should matter to everyone. So to finish out, I just want to remind everybody that just because I am personally affected by this disease, that is not the only reason why I care about it. I think it is important for anybody to realize that anybody can be affected by this. This disease is debilitating. It takes your independence away. I've watched my dad go from this super strong man that does everything to having to ask us to help him down the stairs. You should not wait to push for treatment until you know somebody that is personally affected by it, and just let's give them a fighting chance at life. I'm hoping that with this presentation, I am able to inspire people to go out and push for change and care about people that are affected with ALS. So this is my dad. We do ALS walks every year, and I'm just hoping that this presentation allows us to push people to fight for them, and I hope I'm just educating people on this disease, and I'm hoping that this gets approved soon, so I get a little bit more time with my dad. Thank you.